Hello, I'm Garvin, and this telecast is on Autism Spectrum Disorder. So, Autism Spectrum Disorder is the name for a group of developmental disorders. The ASD or Autism Spectrum Disorder includes a wide range or a spectrum of symptoms, skills, and levels of disability. People with ASD often have these characteristics: ongoing social problems that include difficulty communicating and interacting with others, repetitive behaviours, as well as limited interests or activities, symptoms that typically are recognised in the first 2 years of life, symptoms that hurt the individual's ability to function socially at school or work or other areas of life. Some people are mildly impaired by their symptoms, while others are severely disabled. Treatments and services can improve a person's symptoms and ability to function. Families with concerns should talk to their paediatrician or GP about what they've observed and the possibility of ASD screening. According to the Centre for Disease Control and Prevention, around 1 in 68 children has been identified with some form of ASD. So what is the difference between Asperger syndrome and ASD? In the past, Asperger syndrome and autistic disorder were separate disorders. However, this separation has changed. The latest edition of the manual from the American Psychiatric Association, the Diagnostic and Statistical Manual of Mental Disorders, people whose symptoms were previously diagnosed as Asperger syndrome or autistic disorder are now included as part of the category called Autism Spectrum Disorder. So the signs and symptoms. Parents or doctors may first identify ASD behaviours in infants and toddlers. School staff may recognise these behaviours in older children. Not all people with ASD will show all of these behaviours, but most will show several. There are two main types of behaviours: restricted or repetitive behaviours and social communication or interaction behaviours. So the restrictive repetitive behaviours may include repeating certain behaviours or having unusual behaviours, having overly focused interests such as with moving objects or parts of objects, having a lasting intense interest in certain topics such as numbers, details or facts. Social communication interaction behaviours may include getting upset by a slight change in a routine or being placed in a new or overly stimulating setting, making little or inconsistent eye contact, having a tendency to look at and listen to other people less often, and rarely sharing enjoyment of objects or activities by pointing or showing things to others, responding in an unusual way when others show anger, distress or affection, failing to or being slow to respond to someone calling their name or other verbal attempts to gain attention, having difficulties with the back and forth of conversations, often talking at length about a favourite subject without noticing that others are not interested or without giving others a chance to respond, repeating words or phrases that they hear, a behaviour called echolalia, using words that seem odd or out of place or have a special meaning known only to those familiar with that person's way of communicating, having facial expressions, movements and gestures that do not match what is being said, having an unusual tone of voice that may sound sing-song or flat and robot-like, having trouble understanding another person's point of view or being unable to predict or understand other people's actions. And people with ASD may have other difficulties, such as being very sensitive to light, noise, clothing or temperature. They may also experience sleep problems, digestive problems and irritability. ASD is unique in that it is common for people with ASD to have many strengths and abilities in addition to challenges. Strengths and abilities may include having above average intelligence. The CDC reports 46% of ASD children have above average intelligence, being able to learn things in detail and remember information for long periods of time, and being strong visual and auditory learners, and excelling in maths, science, music or art. Diagnosing ASD. So doctors diagnose ASD by looking at a child's behaviour and development. Young children with ASD can usually be reliably diagnosed by age 2. Older children and adolescents should be evaluated for ASD when a parent or teacher raises concern based on watching the child socialise, communicate and play. Diagnosing ASD in adults is not easy. In adults, some ASD symptoms can overlap with symptoms of other mental health disorders such as schizophrenia or attention deficit hyperactivity disorder or ADHD. However, getting a correct diagnosis of ASD as an adult can help a person understand past difficulties, identify his or her strengths and obtain the right kind of help. So the risk factors for autism. Scientists don't know the exact causes of ASD, but research suggests that genes and environment play important roles. Risk factors include, for gender, boys are more likely to be diagnosed with ASD than girls, and having a sibling with ASD, having older parents, so if your mother was 35 or older and your father was 40 or over when you were born. And genetics, about 20% of children with ASD also have certain genetic conditions. Those conditions include Down syndrome, Fragile X syndrome, and tuberous sclerosis, among others. In recent years, the number of children identified with ASD has increased. Experts disagree about whether this shows a true increase in ASD, since the guidelines for diagnosis have changed in recent years as well. Also, many more parents and doctors now know about the disorder, so parents are more likely to have their children screened, and more doctors are able to properly diagnose ASD, even in adulthood. So treatments and therapies. Early treatment for ASD and proper care can reduce individuals' difficulties while helping them learn new skills and make the most of their strengths. The very wide range of issues facing those on the spectrum means that there is no single best treatment for ASD. Working closely with a doctor or other healthcare professional is an important part of finding the right treatment program. There are many treatment options, social services, programs, and other resources that can help. And so for medication, a doctor may use medication to treat some difficulties that are common with ASD. With medication, a person with ASD may have fewer problems with irritability, aggression, repetitive behaviour, hyperactivity, and attention problems, anxiety and depression. So if you have any questions about autism, you can contact me through the Life Pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.